ECU researchers are working to help patients with vascular disease avoid limb loss. WNCT's Tamara Scott caught up with the doctors behind the research about how this could help the future of medicine.
The prevalence here is high, and unfortunately it's a problem with very few quality options for treatment.
Dr. Joseph McClung is part of a group within the ECU Brody School of Medicine investigating how genetics play a role in limb loss due to vascular disease.
This is a disease of a narrowing of the arteries in the lower limbs. Patients with the worst case of the disease often have gangrenous infections and tissue loss, and there are very few quality options for treatment.
McClung says there are about 20 million people in the United States with peripheral artery disease. That could cost the healthcare system $400 billion, not to mention the effect it has on the East.
Eastern North Carolina in general, there are high incidences of diabetes and high rates of smoking, all of which these two are very strong risk factors and predictors for the development of this critical limb ischemia, the worst case of the disease.
And with these kinds of gene therapies, we're cutting out that middleman and we're going right for the biological process.
Grad student and research assistant Cameron Schmidt works in the labs every day. He says this could be the future for preventing the disease and possibly others like it.
The really fascinating things about this research is that it is kind of the next step beyond drug therapies. Right now, drug therapies that are out there, if there is a drug for a potential issue, is that they mimic biological processes, often with off-target effects.
In Greenville, Tamara Scott, 9 on your side.
McClung says there are about 150,000 amputations related to the disease in the United States annually.